If your feet feel cold even in warm rooms, if your legs tingle, feel heavy, or occasionally go numb when you sit too long, or if you notice swelling that wasn't there a few years ago, you are not imagining it, and you are definitely not alone. These sensations are some of the earliest and most common signs that circulation in your lower body is no longer working as efficiently as it should. And for many adults over 60, this decline happens so gradually that it's easy to dismiss as just aging. But your body is actually sending you a message. Healthy circulation is what delivers oxygen, nutrients, and warmth to your feet and legs. When blood flow slows down, nerves become irritated, tissues lose oxygen, and fluid starts to pool where gravity pulls it most, in the ankles, calves, and feet. That's where the pins and needles feeling, stiffness, and heaviness come from. What makes this frustrating is that many people believe circulation problems require extreme solutions, intense exercise, risky medications, or complicated treatments. In reality, the body's circulation system relies heavily on movement mechanics, not brute force. There is a simple reason these symptoms appear more often with age. As we get older, we naturally move less. We sit more. We stay in one position longer. And while the heart continues to pump blood downward with ease, getting that blood back up from the feet is a completely different challenge. Unlike arteries, veins don't have a powerful pump. They depend on two things: small one-way valves inside the veins and the squeezing action of surrounding muscles. When those muscles stay still for too long, blood slows, pools, and pressure builds. Nerves nearby become irritated. Sensation fades. Discomfort increases. This is why symptoms often appear when you're sitting in a chair, watching TV, or lying in bed, moments when your muscles are inactive. Here's the encouraging part. Circulation problems that come from muscle inactivity are highly responsive to gentle, targeted movement. You don't need to strain your joints or raise your heart rate dramatically. You simply need to reactivate the body's natural return system for blood flow. And the most powerful muscle group involved in that process is located in a place most people overlook: the calves and feet. In this series, I'm going to show you how to reawaken that system using a simple, seated movement that takes about 1 minute and can be done safely almost anywhere. It's designed specifically for seniors and focuses on restoring flow, warmth, and comfort, not exhaustion. Before we get to the movement itself, though, you need to understand what's actually happening inside your veins and why this gentle approach works so effectively. In Part 2, we'll break down the hidden mechanics of circulation, gravity, and the muscle pump, and why most people have been focusing on the wrong part of the problem. Backhand index pointing right. Part 2 explains why circulation slows, and how to reverse it safely. To fix circulation problems, you first need to understand why they happen, and the explanation is simpler than most people are ever told. Your circulatory system has two very different jobs. Arteries deliver fresh, oxygen-rich blood from your heart down to your legs and feet. This part is relatively easy because the heart provides strong pressure. But veins face a much harder task. They must move used blood back upward, against gravity, all the way to the heart and lungs. And here's the key point most people never hear: veins do not have a pump of their own. Instead, they rely on two support systems. The first is a series of tiny one-way valves inside the veins. These valves prevent blood from flowing backward when you're standing or sitting. Over time, and especially with aging, these valves can weaken and lose efficiency. The second system is even more important, and this is where most circulation problems begin. It's called the muscle pump. Every time the muscles in your legs contract, they gently squeeze nearby veins. This pressure pushes blood upward, valve by valve, toward the heart. When the muscles relax, the valves close, preventing blood from falling back down. When this system is active, circulation flows smoothly. When it's inactive, blood begins to pool. Now think about how most people spend their day. Long periods of sitting. Minimal ankle and calf movement. Feet planted on the floor without motion. In this position, the muscle pump essentially shuts down. Blood slows. Pressure builds in the lower legs. Fluid leaks into surrounding tissues. Nerves become irritated from lack of oxygen. That's when symptoms show up: heaviness and swelling, cold feet, tingling or numbness, stiffness when standing up. This isn't a disease process. It's a mechanical problem. And mechanical problems respond best to mechanical solutions. Here's another important detail. As we age, the inner lining of blood vessels becomes less responsive. This lining helps regulate vessel width and blood flow. When it stiffens, circulation becomes less adaptable, especially in smaller vessels. That's why older adults feel changes sooner and more intensely. But the muscle pump remains fully trainable at any age. You don't need strength training. You don't need cardio. You don't need long workouts. You need specific, repeated movement that mimics what walking naturally does, without stressing joints or raising heart rate. The most effective way to do this targets the deepest calf muscles and the small muscles in the feet. These muscles sit directly on top of major veins. When they contract, they produce the strongest upward push on blood flow. And that brings us to the solution. In part 3, I'll walk you step by step through a simple, seated movement that reactivates the muscle pump in under a minute, safely, gently, and effectively. Backhand index pointing right. Part 3 shows you the exact movement that restarts circulation immediately. Now that you understand how circulation actually works, it's time to activate it. This is the simple movement that directly switches your muscle pump back on, without standing up, without strain, and without putting stress on your joints or heart. You can do it right now, exactly where you're sitting. This movement focuses on the calves and feet because those muscles create the strongest squeeze on the veins responsible for returning blood from your lower body. Step 1. The seated ankle rocker. Sit comfortably in a chair with both feet flat on the floor. Keep your back relaxed and your hands resting wherever feels natural. Start by lifting your heels off the ground while keeping the balls of your feet planted. As you lift, gently squeeze your calf muscles and hold for a count of 2. You should feel a mild contraction, not pain, just engagement. Next, lower your heels back down and immediately lift your toes and forefoot, pivoting on your heels. Hold this position for another count of 2. You're now rocking your feet slowly back and forth, heel up, then toe up, in a smooth, controlled motion. This action works like a piston. Each lift gently compresses the veins in your calves, pushing stagnant blood upward. When you release, the valves inside the veins close, preventing blood from slipping back down. Repeat this rocking motion 10 to 15 times at a steady pace. Many people notice a warm or tingling sensation after just a few repetitions. That's blood flow returning. Step 2. The toes spread and curl after the rocker. Keep both feet flat on the floor. Now, focus on your toes. Actively spread your toes apart as wide as you can. Hold this position for 5 seconds, even if the movement feels small at first. Then relax and curl your toes inward, gently scrunching them together. Repeat this spread and curl motion 5 to 10 times. This step does 2 important things. It stimulates tiny blood vessels in the feet and it reawakens nerve endings that often go dormant when circulation is poor. Together, these movements improve sensation and help reduce numbness over time. How often to do it? The entire sequence takes about 1 minute. For best results, do it once in the morning, once in the afternoon, and once before bed. Consistency matters more than intensity. Gentle, frequent movement trains your circulation system to stay active throughout the day. This isn't exercise, it's maintenance. But movement alone isn't the full solution. Blood vessels also need internal support to stay flexible and responsive. That support comes from what you eat and how your body produces key circulation molecules. In part 4, we'll look at the nutritional side of circulation, including the foods and nutrients that help blood vessels relax and improve flow naturally. Backhand index pointing right. Part 4 shows how to feed your circulation from the inside. The 1-minute movement you learned in part 3 is the fastest way to restart blood flow because it reactivates your muscle pump. But for lasting comfort, your blood vessels also need internal support, especially as you get older. That support comes down to one key concept: vessel flexibility. When blood vessels are flexible, they widen easily and deliver oxygen smoothly to nerves and tissues. When they stiffen, blood struggles to reach the smallest vessels in your feet, and symptoms like coldness, tingling, and numbness become much more common. One of the most important molecules for vessel flexibility is nitric oxide. Nitric oxide acts like a natural relaxer for your blood vessels. It signals the vessel walls to loosen slightly, creating more space for blood to move through. With age, nitric oxide production often declines, which contributes to narrower vessels and reduced circulation. The good news is, your body can boost nitric oxide when it has the right raw materials. The best nitric oxide foods. The easiest way to support nitric oxide isn't through complicated supplements. It starts with nitrate-rich foods your body naturally converts into nitric oxide. Some of the top options include leafy greens like spinach, arugula, and kale, beets and beet juice, celery and other crisp green vegetables. A small serving of these regularly can support better vessel response, which means improved circulation to the feet over time. If you want the simplest upgrade, add one of these to breakfast, a green smoothie with leafy greens or a small beet-based drink. Or a salad-style side with your first meal. It doesn't need to be perfect. It just needs to be consistent. Protecting the vessel walls. Better circulation isn't only about widening vessels, it's also about protecting them. Two nutrients often involved in vessel support are vitamin C and vitamin E. Vitamin C helps your body produce collagen, which acts like a structural support for tiny blood vessels and capillaries. Think of it as reinforcement for the walls of your smallest pipes, especially in the feet where circulation is most fragile. Vitamin E acts as an antioxidant, helping protect blood vessel tissue from oxidative stress, one of the factors that contributes to stiffness and irritation in the long term. Foods that support this include citrus fruits, bell peppers, and berries, vitamin C, nuts and seeds like almonds and sunflower seeds, vitamin E, reducing inflammation helps flow. Inflammation makes vessel walls less smooth and less responsive. That's why omega-3 fats, from fatty fish or quality supplements, are often recommended for circulation support. Less inflammation means blood vessels stay calmer and more adaptable. Now here's the important thing: nutrition doesn't replace movement. It reinforces it. Movement pushes blood. Nutrition helps the vessels stay open, flexible, and responsive so that blood can actually reach the nerves and tissues that need it. In part 5, we're going to talk about the nerve side of this problem, because numbness and tingling aren't just circulation issues. They're often signs that nerves are underfed and overstressed. And I'll show you the key nutrients and simple stimulation methods that help nerves wake up again safely. Backhand index pointing right. Part 5 explains why numbness happens, and how to calm it down. By now, you understand how slowed circulation affects your legs and feet. But there's another layer to this issue that often gets overlooked, and it explains why some people still feel tingling or numbness even when swelling improves. That layer is nerve health. Your peripheral nerves are the communication lines between your brain and your feet. They rely on a steady supply of oxygen, nutrients, and protective compounds to function properly. When circulation slows, these nerves are often the first tissues to suffer. Nerves are extremely sensitive to low oxygen levels. Even small reductions in blood flow can cause them to misfire. That's what creates the pins and needles sensation, burning feelings, or loss of sensation in the toes and soles of the feet. Over time, if this situation continues, nerves can become irritated or damaged, a condition commonly referred to as peripheral neuropathy. The good news is this: nerves can recover, especially when the issue is poor circulation rather than permanent damage. But nerve recovery requires two things: restoring blood flow, feeding the nerves directly. You're already addressing the first with the 1-minute movement and circulation supporting foods. Now let's focus on the second. Key nutrients for nerve support. One of the most researched nutrients for nerve comfort is alpha-lipoic acid, often called ALA. It's a powerful antioxidant that supports nerve metabolism and helps reduce oxidative stress inside nerve tissue. ALA has been studied extensively in people with nerve discomfort related to poor circulation and aging. Many report reduced tingling and improved sensation over time when it's used consistently. Another critical group of nutrients is the B vitamins, especially B12, which supports the protective sheath around nerves, B6, involved in nerve signaling, folate, B9, which supports nerve repair and blood health as we age. Absorption of certain B vitamins, especially B12, often declines. This means even people who eat well may still fall short. The form matters. This is an important detail many people miss. Not all forms of vitamin B12 are equally effective. Some forms are harder for older bodies to convert into usable forms. Choosing an already active form allows your body to use it immediately, especially important when nerve comfort is the goal. Gentle nerve stimulation. In addition to nutrition, nerves respond well to gentle physical stimulation. A simple technique is rolling the soles of your feet over a textured object, like a foot roller or even a tennis ball, while seated. This lightly activates nerve endings and helps retrain sensation without causing stress or pain. Think of this as reminding your nerves how to talk again. Combined with better circulation, these small inputs can gradually improve comfort, balance, and confidence when standing or walking. But nerve support alone still isn't the whole picture. In Part 6, we'll explore advanced strategies that amplify everything you've learned so far, including breathing techniques and positioning methods that help blood return to the heart more efficiently. Backhand index pointing right. Part 6 shows how to supercharge circulation without extra effort. Up to this point, you've addressed the two biggest drivers of poor circulation: lack of muscle movement and undernourished blood vessels and nerves. For many people, those steps alone create noticeable relief. But there are a few advanced strategies that can dramatically amplify your results, and they don't require equipment, medication, or extra strain on your body. They work by using physics and pressure to your advantage. Deep breathing, the hidden blood flow pump. Most people think breathing only affects the lungs. In reality, the way you breathe has a powerful effect on circulation, especially on blood returning from the legs. Deep, slow breathing using the diaphragm changes pressure inside your abdomen and chest. When you inhale deeply, pressure drops inside the chest cavity, creating a gentle vacuum effect. This vacuum helps pull blood upward from the lower body toward the heart. Shallow breathing doesn't do this. To use this effect, lie down or sit comfortably. Place one hand on your belly. Breathe in slowly through your nose, letting your belly rise. Exhale slowly through your mouth. 5 minutes of this once or twice a day can noticeably improve venous return, especially when combined with the ankle rocker movement. Elevation, making gravity work for you. Gravity is the biggest obstacle to lower body circulation, but it can also become your ally. When your feet are slightly elevated above heart level, blood drains more easily from the legs. This reduces swelling, pressure, and that heavy, tight feeling many people experience in the evening. You don't need extreme positions. Simply resting your legs on a cushion or footrest for 15 minutes a couple of times per day can help reset circulation. This is especially helpful after long periods of sitting. Warmth, opening the smallest vessels. Warmth naturally relaxes blood vessels. A warm foot soak at the end of the day causes vessels in the feet to widen, allowing trapped blood to move more freely. This often reduces nighttime cramping and discomfort. Adding a few drops of circulation-supporting essential oils can enhance the effect, but warmth alone is effective. Hydration matters more than you think. Even mild dehydration thickens blood. Thicker blood moves more slowly through tiny vessels and places extra strain on the heart. Regular fluid intake throughout the day helps keep blood flowing smoothly. Don't wait until you feel thirsty. By then, circulation may already be compromised. Why these techniques work together. Each of these strategies improves circulation in a different way. Breathing improves upward pull. Elevation reduces resistance. Warmth opens vessels. Hydration improves flow quality. Used together, they create a powerful support system that reinforces the 1-minute movement and nutritional steps you've already learned. But there's one more piece that can undo all of this progress if you're not careful. In Part 7, we'll talk about the common habits and mistakes that quietly sabotage circulation, even in people who are doing everything else right. Backhand index pointing right. Part 7 shows what to stop doing to protect your progress. At this stage, you may be doing many things right: gentle movement, better nutrition, breathing, elevation. But here's the uncomfortable truth: a few common daily habits can completely cancel out all that progress. These habits are so normal that most people never question them. Yet they are some of the biggest hidden reasons circulation continues to decline with age. Let's bring them into the light. Mistake number 1: sitting too long without movement. The human body was never designed to sit motionless for hours. When you sit for extended periods, especially with knees bent and feet planted, blood vessels in the hips and thighs are partially compressed. This creates a bottleneck. Blood struggles to reach the lower legs, and the muscle pump shuts down. Even if you do the ankle rocker once or twice a day, long uninterrupted sitting can undo the benefit. The fix is simple: interrupt sitting every hour. You don't need exercise. Just stand, take a few steps, stretch, or do the 1-minute movement. These microbreaks restore pressure changes that keep blood flowing. Mistake number 2: crossing your legs. Crossing your legs may feel comfortable, but it's one of the worst positions for circulation. When you cross one leg over the other, you compress the large artery and vein that supply the lower leg. This acts like pinching a garden hose. Blood flow drops immediately, and pressure builds below the pinch point. Over time, this habit contributes to swelling, numbness, and vein issues. A better position is sitting with both feet flat on the floor or slightly elevated, keeping blood vessels open and unobstructed. Mistake number 3, tight clothing and footwear. Anything that constricts blood flow works against circulation. Tight socks that leave deep indentations, restrictive shoes that squeeze the toes, or clothing that compresses the waist or thighs all reduce blood return from the legs. Your clothing should support movement, not restrict it. If something leaves a mark on your skin for hours, it's too tight. Mistake number 4, ignoring early symptoms. Many people wait until numbness, pain, or swelling becomes severe before taking action. Unfortunately, circulation problems are easier to reverse early. Tingling, coldness, or heaviness are not minor annoyances. They're early warnings. Responding early with gentle movement and circulation support prevents progression. Mistake number 5, thinking more force is better. Aggressive exercise, harsh stretching, or forcing movement can irritate joints and nerves. Circulation responds best to frequent, gentle activation, not intensity. Small movements done consistently outperform occasional hard efforts every time. By avoiding these mistakes, you protect the progress you've already made and allow your body to respond to the positive changes. Now we're ready to put everything together. In Part 8, I'll show you how to combine movement, nutrition, breathing, and positioning into one simple daily routine, and close with the mindset shift that makes all of this stick for life. Backhand index pointing right. Part 8 ties everything together into a routine you can actually live with. At this point, you've learned something incredibly important. Poor circulation is not a mystery, a curse, or an inevitable part of aging. It's a system problem, and system problems respond best to simple, consistent care. Now it's time to bring everything together into one smooth daily routine that feels manageable, not medical. This isn't about doing everything perfectly. It's about creating flow, literally and figuratively. Morning. Wake up your circulation. Start your day with a glass of water. Overnight, your blood becomes slightly thicker, and rehydration helps restore smoother flow. With breakfast, include at least one circulation-supporting food, leafy greens, a small beet-based option, or another nitrate-rich vegetable. After getting dressed, perform the 1-minute ankle rocker and toe spread. This kickstarts the muscle pump and sends fresh blood down into your legs before stiffness sets in. That 1 minute sets the tone for the entire day. Midday, keep the flow moving every hour or so. Interrupt sitting. Stand up. Walk a few steps. Do a few ankle rocks if you're seated. If your day allows, take 5 slow, deep belly breaths at some point in the afternoon. This improves blood return from the legs and calms the nervous system at the same time. If you feel tingling or heaviness creeping in, that's your cue, not a warning. Respond with movement, not worry. Evening, drain and restore. In the evening, gravity has been working against you all day. Now you flip the script. Elevate your legs slightly above heart level for 15 minutes while reading or watching TV. This helps drain pooled blood and reduce swelling. A warm foot soak can be added if your feet feel tight or cold. Warmth opens small vessels and improves comfort before bed. Before sleep, do the 1-minute movement one last time. Many people find this reduces nighttime cramps and restless sensations. The bigger picture altogether, this routine takes less than 30 minutes spread across the day, most of it while you're already sitting. And the benefits go far beyond circulation. Better blood flow means warmer feet, calmer nerves, improved balance, reduced swelling, and greater confidence when standing or walking. But perhaps the most important change is psychological. You stop feeling helpless. You stop waiting for symptoms to worsen. You start responding early, gently, and effectively. That numbness, tingling, or heaviness was never a final verdict. It was a signal. And now, you know how to answer it. Start small. Commit to that 1 minute. Let your body do what it's designed to do when you give it the right support. If you found this video helpful, make sure to hit that subscribe button and tap the bell icon. That way, you'll never miss any future updates, tips, or powerful health insights that can keep you strong, active, and healthy for years to come. Your journey to better health starts right here. Don't miss out.